I'm Dr. Huffer. I'm one of the faculty here, and I want to welcome you into our webinar tonight. Hopefully this will be a very informative session. It's really meant to be an informal, informative session, so that if you have questions, please interrupt, ask your questions, and we will hopefully have the right answer for you. But we're really super happy you're here and have an interest in coming to Shepherd, or at least learning about Shepherd. So I'm going to share my screen. So again, I want to welcome you into our webinar tonight. This is one of the very beautiful shots of our campus. So we are located in Shepherdstown. This is definitely a college community, but it's a very historic community. It has a lot of historical roots in it from back in the 1700s. So if you ever get the chance to read about the history of Shepherdstown, it's quite fascinating. We are located right off of the Potomac River. Part of our campus actually goes, you can look down the bank and there you go see the river. We are a small public liberal arts university, and our campus incorporates 323 acres. Our student population is approximately 3,100 students. And this is the best part of all, is we have a very good faculty to student ratio of approximately 14:1. So coming to Shepherd means you don't get lost in the crowd. Faculty is there, they know who you are, and we do form relationships with our students at all levels, particularly with the DNP students, because you seem to be a little smaller in number than our undergrad students, so we get to know you quite very well. So this is a picture of Irma Ora Bird Hall. This is our nursing building. It's about 37,000 gross square feet, and we have all types of classrooms with various levels of technology. We have a simulation lab, which includes acute care, critical care, mother baby, pediatrics, independent living. Part of that independent living simulation lab is converted into the DNP lab, which helps students practice physical assessment and exam techniques that are done in the primary care setting. So we have the exam tables and the otoscope and ophthalmoscope and those types of equipment to help students get comfortable doing that in more of a primary care setting. All of our faculty is highly credentialed and experienced, and we'll talk a little bit more about some of the faculty here in just a second. So Dr. Maley is our Dean of the College of Nursing, Education, and Health Sciences, and she's also the director of our School of Nursing. Dr. Maley, would you like to say hi? Just unmute yourself and unmute.
Thank you. I waved and said hi.
Okay.
Good to be here. We're excited.
We have two other faculty on tonight. Dr. Kara Barker, she is a doctor of nursing practice, actually one of our graduates from our first cohort of our DNP program for the Family Nurse Practitioner Program. And she is currently our Family Nurse Practitioner Program Coordinator. Kara, would you like to say hi?
Hello, thanks for joining us.
And then also with us is Dr. Brenda Johnston. She is also a doctor of nursing practice, and her specialty is psych mental health nurse practitioner. She is the coordinator of our psych mental health nurse practitioner program.
Hello and welcome.
And then there's me. I'm on here because I am the director of our HRSA Impact Grant. And that grant is now in its just about ready to complete its third year of a 4-year cycle. It is a HRSA grant that is devoted to increasing nurse practitioner experiences in rural health and promoting rural health placement to students for clinical placements in the program. There's also a lot of other faculty here we haven't talked about. Our faculty is all doctorally prepared. There are 2 more DNP nurse practitioners, one pediatric and one family, that aren't with us tonight. And then we have a number of PhD faculty as well. So our DNP program has multiple entry points depending upon what's your best option. Our DNP FNP Family Nurse Practitioner Program, most of those students come in with a bachelor's degree, and it is a bachelor's to Doctor of Nursing Practice degree track primarily. However, we do admit students who also have master's degrees, sometimes in nursing education and in other areas of nursing that want to complete that DNP FNP program. And then we have some family nurse practitioners who want to just complete the DNP part of the program. So we have a specialized track for that, as well as a postgraduate certificate program for nurse practitioners who may be adult, geriatric, and/or pediatric certified and want to become family nurse practitioner certified. We have the similar tracks coming into the DNP Psych Mental Health Nurse Practitioner Program. Primarily, again, it is a bachelor's to DNP program with those other possibilities depending on educational background. And then the third slide there shows about the postgraduate FNP and postgraduate Psych Mental Health NP certificate program. This is actually Dr. Dr. Berkey. We have a Dr. Berker and a Dr. Berkey here. This is Dr. Berkey. She is teaching the diagnostic reasoning class here to some of our graduated nurse practitioner students. Dr. Berkey's been here for about 7 or 8 years now, and she also sits on the Board of Nursing for West Virginia. So we're really proud of her accomplishments, and she adds a lot to our faculty. Our tuition is approximately $767 per credit hour for all students, regardless of whether you're in state or out of state. There is a $200 fee for each course that contains clinical courses. I'll talk a bit about the progression and that in a few minutes, but mostly that $200 fee does not apply until your second year of the traditional BSN to DNP program, because that's when the clinical courses start. First year is focused primarily on the theory and getting some of the pathophysiology, the physical assessment, the pharmacology out of the way before you start the clinical courses. We do admit as a cohort, and you stay with your cohort the whole time as long as you're progressing on schedule. Our curriculum delivery is hybrid format, so both the FNP and the Psych Mental Health Nurse Practitioner programs have a total credit hour of 84 to approximately 86 total credit hours. And that is basically getting the BSN from to the master's to the DNP, although we do not award a master's degree in the middle of our program. We don't award a degree until you complete the DNP part. There is also 1,080 clinical hours associated with the degree. And that is both in office type clinical situations and also your DNP project. Those hours count towards that too. We'll talk about that in just a few minutes. When you come in as a cohort, we usually assign you a class day, either a Tuesday, a Wednesday, or a Thursday, depending upon which day we're working with for that year. And that class day remains consistent for the entirety of the program. So if you are admitted as a Tuesday cohort, your classes stay on Tuesday for the entire program until you graduate. You don't have to come to class any other day other than the day that you're admitted. So we do try to work that in. It does become a long day for a lot of students, but it frees you up to be able to actually work while you're coming to school. We have a full-time only option, which is usually 9 to 11 credit hours per semester. And those semesters are year-round. So we do have summer courses as well as fall and spring. Upon admission, you're given a DNP handbook, and that outlines all of the policies and procedures, and it will basically walk you through your program. So it's a very helpful tool as you come into the program. So I'm going to turn it over to Dr. Berker, and she's going to talk a little bit about the FNP.
So this is a sample of the FNP curriculum progression plan, the different courses that you would be taking in the program in the FNP track. So similar to the Psych Mental Health Nurse Practitioner, there's 3 full years. So it's fall, spring, and summer semester for 3 years. Beginning in the fall of year 1 through the summer are what we call the 3 Ps: advanced physical assessment, advanced pathophysiology, and advanced pharmacology. And those are 3 core courses that are standard in nurse practitioner programs. Once those courses, and along with those courses are additional coursework in theory, and there's grant writing, just sort of diagnostic reasoning, all sorts of classes that help sort of prepare for those medical decision-making skills that we develop as in the nurse practitioner program. In the second year, starting in the fall, students begin actual clinical time. That is when they are placed with a preceptor. So it's a one-on-one situation, one student with a preceptor. And for the fall semester, there's time in women's health, gerontology, and what we call adult health 1. So adult health 2 is in the spring semester. And in the fall semester, there's 60 hours of women's health, 60 hours of gerontology, and 120 hours in adult 1. We help students find clinical placement and find preceptors. We have an extensive list of preceptors that we've worked with in the past, and we're always open to new folks. If a student has an interest of working with a particular person that maybe we haven't worked with before, we will certainly pursue that to try to get the administrative things in place so students can be with the preceptor of choice for them. Starting in the spring, the student will do time with pediatrics in that clinical environment, as well as another 120 hours of adult time. And so those hours are completed in the spring, and then in the summer semester, there's vulnerable populations, which has 60 clinical hours associated with that. And that is in any of the many settings in our area, not just in West Virginia, but in the surrounding areas where there's many underserved populations in this particular area where folks are not getting all of the healthcare services and access to services that they need. So students can spend some time in those environments learning and experiencing those patients. So within that those first 3 semesters, there's 540 total clinical hours for students to complete through that summer semester. Beginning in the fall and beginning in the spring semester of the second year, students identify a topic for their DNP project. So that's sort of the hallmark of the DNP program, is the DNP project. It's really what sets a DNP degree apart from a master's in nursing as a nurse practitioner. So the DNP project is an evidence-based quality improvement project that a student finds an area of interest and develops a proposal and it's a fairly large scale project that students work on from the spring of the second year clear through to potentially the summer or the spring of the third year, depending on when they finish their project. So they begin working on that in the spring semester, then the summer, and all of that third year is time spent working on that project. In addition to that, there is another 360 hours of time in what is considered the DNP practicum. So that is after the clinical, the clinicals in women's health and gerontology and adult and peds are finished. Students have an additional 360 clinical hours of time in an area of their choice. So it's really lots of opportunities for different experiences, such as urgent care, maybe a specialty practice, cardiology, dermatology, anything that might be of interest to the student. And we certainly, again, help facilitate those clinical placements, but that's really up to the students' interest as to what they want to experience while they have the opportunity to work one-on-one with someone in a precepted environment. Those 360 hours are completed over 3 semesters, and it's really however the student wants to complete those hours. It's paced by them, and really they determine how they want to schedule those hours. We just help facilitate making that happen for them. In addition to those courses, those clinical project and practicum hours, there's a lot of other courses within the final 3 semesters or the final 2 semesters, fall and spring, that sort of help students develop that DNP project. So evidence-based practice, learning about how to develop and implement an evidence-based project that they are working on as their DNP project. Finally, the student should be finished in the summer of the third year, with that final semester being just finishing up practicum hours and project. So that's basically the 9 semesters that, in summary, that are what make up the FNP curriculum.
Thank you, Dr. Berger. Dr. Johnston, if you want to talk about the BSN Psych Mental Health Nurse Practitioner Program.
Yes. So with the second semesters or the second year, if you're taking the psych specialty, the first part of that semester, you're really concentrated in psychiatric courses, which include neurosciences and psychopharmacology, as well as addiction, substance abuse, and management of persons with addiction. You will be taking a theory course that's Foundations of Psychotherapy, and that actually replaces the theory course from the very first year, first semester. So that would actually be your first psych course, would be in that fall of the first year. And then in the second would be all of the rest of your psych courses. So we focus initially in that first semester with clinical rotations and coursework that focuses on the individuals and individuals therapy and treatments. With the spring semester, we focus on groups and individuals, as well as continuing with individuals. In that spring semester, you would be taking genetics as well as a separate course on child and adolescent psychiatry. In the summer semester is all about kind of synthesizing the information from both the fall and the spring semester. And we do a lot of supervision during that particular course. So meeting with students regularly and with their preceptors and doing case management, case discussions, basic supervision, and also working on DNP projects.
Thank you, Dr. Johnson. So I talked earlier about 1,080 hours of clinical. Again, this is starting mostly in the second year of the program. And for the FNP program, we're focusing on primary care, and behavioral health is the focus of the psych mental health NP program. As Dr. Berger discussed, there's opportunities for specialized rotations in the third year, depending on your individual interests. We do have excellent preceptors, excellent clinical partners in the region. We do have rural health opportunities, vulnerable populations opportunities. So we take a lot of pride in the fact that we have some excellent clinical sites for you to learn. Dr. Berger also talked about the Scholarly Project. Again, it's the culmination of the DNP educational experience. It is a quality improvement initiative. It is not novel research. And you'll work closely with a faculty mentor who becomes the chair of your committee and helps guide you through this process. At the end, of course, we always encourage dissemination through either publication or presentation, because you work really hard for this over the two and a half years that you're working in this project. And what you come up with is meaningful. It's always meaningful. And we encourage students to move outside of the comfort zone and outside the box and go ahead and publish that, because that's how we get information out there about the work that you do. The DNP Scholarly Project is a minimum of 160 project hours, generally 60 per semester. There are many students that spend more time than that in the project, and that's okay. It really is independent depending upon which topic you choose and the nature of your project. So that is very flexible. At the end of the program, you can sit for the certifying boards. For the family nurse practitioner, 2 possibilities exist, the AACN and the AANP. You may sit for either exam. We don't really care which one you sit for, it's your decision. But one of the perks of our FNP program is that we do offer the Fitzgerald FNP exam prep course as part of your program. So this course really helps you to focus in on areas that you need to concentrate on to study in order to be successful and pass. Currently, Shepherd has an FNP pass rate of 100%, very proud to say. The Psych Mental Health Nurse Practitioner certification exam is through the American Nurses Credentialing Center, ANCC. And the Barclay Psych Mental Health Nurse Practitioner Exam Prep is what's used. Because our Psych Mental Health Nurse Practitioner program launched in the fall of 2022, we do not have pass rates available, but we do have people in that program. So we're looking forward to help mentoring them through that process and putting more psych mental health nurse practitioners out there. As myself and Dr. Berker as primary care nurse practitioners, we know the value of these psych mental health nurse practitioners, and there's just not enough of them in our communities. So we're super happy we have this program on board. So if you're interested in applying to Shepherd, you can apply through the Nursing CAS system, and the website is there. There's also more information on our Shepherd website if you are so inclined to go that route. We do have an orientation that we have in August. It is an in-person and usually lasts about a day to a day and a half. We discuss things like out-of-pocket expenses because, you know, as you remember from undergrad nursing, nursing is expensive. And there are some out-of-pocket expenses that you have as a nurse practitioner as well. And we have a white coat ceremony, very similar to it's actually with the BSN students that we honor our doctoral students with a long white coat rather than a short white coat. And these are the contact folks. I want to introduce Kara Rolfe. She's on my screen. She's down in the left lower hand corner there. So Kara, do you want to talk a little bit about yourself?
Well, I'm the administrative associate for the DNP program, and I'm here to kind of help with the application process and any questions you might have applying through CAS. I'm here to help.
And without Kara, we couldn't be together as a program because she is the cog in the wheel and she makes us all work. So we certainly appreciate Kara doing what she does. So if you have questions, you can email or call any of these contacts, including Kara.
Dr. Watson-Hupper, thank you so much. This was so informative. We really appreciate your putting together our message and sharing it. This will be available on our websites. We had several people sign up, and we're having storms here in our area right now, so I'm sure that influenced some individuals' availability. But we're thrilled to meet you, and hopefully we'll get to see you in person. Come down to Shepherd, or we can do a Zoom in terms of helping you fulfill your dream to be the nurse practitioner you want to be. We have a job ready for you, and it's a 6-figure salary. So we'd love to have you here at Shepherd.